Hi, everyone. Welcome to the last installment of the Healthcare Quality Week interview series. My name is Stephanie Mercado, and I'm the CEO and Executive Director of NAHQ, the National Association for Healthcare Quality. Joining me today is Emmett Ervin. He's the Vice President of Clinical and Regulatory Compliance at the University of Maryland Medical System. Hi, Emmett. It's great to be here with you today.
Hey, Stephanie. How are you?
Good. I'm excited for Healthcare Quality Week. So it's been a great week so far. Lots of activity. Love what we're seeing on the LinkedIn and Facebook and other social channels. There's a lot of people having a great week, and that makes us so happy.
Same here.
Great. Well, I have a couple questions that I wanted to cover off with you on regarding sort of your journey in healthcare quality. And we have spoken earlier this week. I spoke earlier this week with Josh Berlin from Rule of Three and April Taylor, who is a NAHQ board member. And we had been talking about planning for 2022, talking about how do you get your organization prepared for what they need to deal with the external environment and really get your quality system sort of set up for success. And today, our focus in chatting with you is going to be around how do you set up your own self for your personal success and really think about that continued professional development, that lifelong learning, so that as we're advancing healthcare, we're advancing our own careers. So that's going to be the focus today so that everyone knows. I know you know that too. So let's hop to it. First question for you, Emmett, just lay the groundwork for us. Tell us a little bit about your career and how you got to where you are today.
Sure. Well, back in 1986, I had a job in Silver Spring, Maryland as a job coach. I was there for maybe a year, got homesick, moved back home to Texas, and I went to work with developmentally delayed children at a residential treatment center. So after being a mental health worker for 6 months, the owner of the company promoted me to something called Quality Assurance Coordinator. That's how far back it was. It was quality assurance back then. And from there, I went to graduate school, started corporate roles. So I'm prepared in many of the settings: acute med surg, medical, behavioral health, rehabilitation. So each one of my roles, I've intentionally chosen to always have a quality slant to it.
So that's a familiar story in terms of just sort of finding your way into quality. We know that most people come into healthcare quality because they were really good at something else. Mm-hmm. And then they get sort of bitten by that quality bug and begin their professional development journey to really understand how to do their best work in quality. So familiar story. I know a lot of people out there will resonate with that as well. Yeah. So great. So let me ask you a question about regulatory and compliance and accreditation topics here. So as we were speaking with Josh and April, the topic always comes up around how do you keep up with everything that's changing in healthcare quality, regulatory compliance, accreditation. You know, it's a lot. I see the regs when they come out and they're deep, and it really takes a lot to sort of work your way through that. So talk to me about how you as a quality leader sort of attack that and make sure that you're keeping up.
Sure, great question. Historically, I've always tapped into listservs. I always maintain a contact at the respective accreditation system. For example, well, I don't want to bore you with the example, but there are many accreditors out there, but I have quarterly calls to make sure that I'm current with all the changes, different trainings. I establish my own networking group, associations. For example, there's a PT Association for Physical Therapists, Nursing Association at the state, region, division level. So those are some of the ways I maintain my current knowledge, but also I think most of us in healthcare quality, we're wired differently because we actually look forward to the standards and regulations coming out. I see the smile coming, right? We have our highlighters together, so we always highlight and note any and all changes, and we get that information out to the respective stakeholders.
Yeah, I have learned over the years, I've had 8 great years working with NAHQ, and people who work in quality love details and they live to improve. Two of my favorite things about working with this profession. So great. Well, so talk to us a little bit about how you connect with other people. I know that a lot of our colleagues in the field are oftentimes sort of, put in these quality roles, find themselves in the role of regulatory compliance, and they're not really sure where to start. I know that you've had some really great mentors over the years and would love for you to talk just a little bit about how you approach that. Usually mentors don't come knocking on your door and say, hey, you look like you could use a hand, let me help you out. Oftentimes, people who need mentoring have to find a mentor to help them. So how has that worked out for you?
Well, actually, I didn't know what a mentor was when I first started 30 whatever years ago, but I have three that resonate with me, one of which I met in 1986 at the Residential Treatment Center. He gave me my first job, and he actually hired a Joint Commission surveyor who also consulted on the side. And so I worked with her for a year to understand the rationale of why we have standards, why standards are important, how they can really impact patient care. I didn't know it then, but now when I look back, he really took a chance on me and believed in me and monitored me for the next 25, 30 years. The next job after that, I had a job as a quality assurance coordinator in one of two forensic psychiatric facilities, locked units within the state of Texas. And my manager, when I look back on it now, she took a chance. I was a 25-year-old non-clinical individual with 6 months of quality experience, but she saw something in me, and we're still in touch today. And in a bit, I'm going to tell you about what she saw in me. And then the last person is an individual named Dr. Hugh Shavern. He's a former surveyor who was also on the board. He was tough. He was very, very tough. He always pushed me. I couldn't see it then, but now that I'm more mature, I understand that they saw somebody who had a good sense of urgency, great results orientation, and I'm socially sensitive to the population served. And that's what I look for when I see young people in the field today. After NAHQ Next, I think it was Cincinnati, a couple of years back, I had an individual, very young individual to me, find me on LinkedIn, and he flat out said, I want you to be my mentor. Would you please take the time?
Wow.
Right. So I don't say no to that. So he and I have been together for 3.5, 4 years now. When you're playing the role of a mentor, and it's always good to reach back and help others, the recipient needs to be humble and be open and receptive to feedback, right? I feel it's our jobs as people who've been in the field for a little bit of time to always be willing to share the knowledge we've had and learned, and also they can learn from the mistakes that we've made, because we all fumble every now and then. So share that, and hopefully they receive the feedback in an open spirit in which it's sent, because they want you to be successful also. It's a win for them.
Right. So when you're talking, I'm hearing two things. I'm hearing skill and I'm hearing will. And so when I think about skill, NAHQ has a lot to offer around the skill building. And I know that you have spent a lot of time, not only as a learner with NAHQ, but also as a leader with NAHQ, sort of making your way up the governance ranks at NAHQ, and now going to be the incoming president of NAHQ in 2022. Super excited about that. And so, as a contributor to that, I know well our healthcare quality competency framework, our frontlines training for quality and safety, our principles, CPHQ prep. So there's a lot there. But I want to take just a second and talk a little bit about this topic of will, right? Because skill, I think, is the lock and the will is the key. And we have to put those two things together if we are going to be successful in any part of our life, and regardless really of even the profession that we're in. So I really like what you're saying about that will, that curiosity, the intentionality, the drive, the grit to kind of, work your way through stuff, even when it's hard. So really, really important message I think you're bringing forward.
Sure. And I think anybody in this space, I mean, we all enter the space to help others. Being competent, qualified, that's the only way to go. I mean, healthcare quality professionals, we're viewed as the conduit to facilitate movement within any part of the continuum. So I've always believed in NAHQ. I think I've been with NAHQ for 8 or 9 years in a variety of positions. And this one coming up in 2022, it truly is a dream come true, truly.
Great. Well, I am personally looking forward to that. So let's close out with one more question for you regarding how you think about your own professional development and how you prepare to be intentional about your planning process and what that looks like for you for 2022.
Sure. Well, just going back in time, I initially decided in 2004 to get the credential. At the time, I've done research, and I realized that the CPHQ, it is the premier, and as we know, the only accredited certification in the space. And so I developed an actual development plan with metrics. I was real about it. I determined where my room for growth was. Won't bore you with where those are. But I developed, a development plan with quarterly check-ins, 3, 5, 7, 9 years. I was real about it. I took the exam, and I'm a little bit disappointed that I let fear stifle me, right? So I'm assuming that some people on this interview right now that are listening, they're probably stifled with a little bit of fear. My suggestion is to follow my lead, develop that personal development plan with clear metrics, right? Do that quarterly check-in, make the goals reasonable, because once you become certified, you really will set yourself apart from the other providers out there.
Agree. Actually, I was speaking to the CEO, Jeff DeLisi at Roper St. Francis the other day, and I was asking him about how he viewed CPHQ and if he felt like it was really making a difference. But we feel like it's making a difference, but did he as a CEO of a health system? And what he told me was that if he had 2 equal candidates and one had the CPHQ, he'd pick the CPHQ without question. So that was great to hear. I'm glad it's having utility in the field. I'll also say, just to kind of break through any of that, the fear factor that you mentioned, about a year and a half ago, we actually, was right around when COVID, surfaced, and we wanted to make sure people had access to as many quality tools as possible and access to the CPHQ. We actually tried to remove some of those barriers. And we actually, at this point, have a practice exam for the CPHQ that's free on NAHQ's website for anybody who wants to try it out. It's, I think, 25 or 30 questions just to kind of get your feet wet, understand what some of the topics are, what some of the questions might be, and in a real safe environment, just give it a shot. And then, of course, much more extensive practice exams as well that people can, purchase if they're interested. But the first step, we want to just remove a barrier and make sure that people could try it out. So that sounds great. Well, Emmett, it has been great chatting with you today. Thanks so much for your input.
Do you have a quick second, Stephanie? I actually have a question for you.
Okay, let's turn the tables. All right.
You've been with NAHQ pretty much 8 years, and you've already impacted healthcare quality so much thus far. So my question to you, Stephanie, is where do you see NAHQ in 5 to 10 years?
That's a great question. It's a big question, and I'm really excited and happy to be able to give you the answer. So, I think NAHQ's done a really good job over the past few years of keeping a really intentional focus, and that is to lead the people who lead the profession of healthcare quality. So for us, that means more of what has been on offer and supporting individual contributors, because that is really the fabric of who we are at NAHQ, and additionally supporting organizations. Organizations being the employers who are looking to leverage their workforce. A few years ago, you may recall, I was working with the board, and I thought, oh my gosh, it is going to take forever if we try and change healthcare quality, one quality professional at a time. So adding in that corporate opportunity to work with organizations to train their team, to assess their teams around the healthcare quality competencies and work on upskilling, I think is huge. And then also, I hope that we will, in the next 5 or 10 years, have made a dent in the academic work, because I'm a big fan of moving upstream to solve challenges. David Nash talks often about, turn off the faucet, don't mop up the floor. And in terms of thinking about that, I mean, we got to get into these undergraduate and graduate training programs and hardwire quality competencies into them. A lot of organizations I speak to say, yeah, well, we do it our way. We have a special, methodology and way to teach quality here at XYZ University. And I think that there's always a secret sauce, right? That's why organizations pick or individuals pick one organization over another to go to school. That being said, I don't think we have to get cute with quality. And I think that there's some fundamental things that should be the tie that binds, and that those things should be standard in every academic program for clinical and non-clinical disciplines. So we're going to keep doing what we're doing. We're going to support those individuals. We're going to work with corporations who are in healthcare systems across the continuum of care, and academics. And one more thing, we're going to keep trying to give that professional hug. I think that the people who do quality don't always think that they have a home. They often came from other professions and are really trying to find their way in quality. And so we want them to feel at home here with NAHQ. We want them to feel supported, and we want them to feel as if we're their biggest fan, because in fact we are, and we're really proud of the work everybody's doing out there. So that's where we're going to be.
That's great. Thank you for that.
All right. Well, thanks, Emmett. Our time is up today. It's been great chatting with you. I want to wish everybody a great rest of your healthcare quality week. Also, too, I don't know if everybody has heard about this, but we actually have some swag. Everyone's always looking for quality swag, NAHQ swag. It turns out we have a pop-up store, like those food trucks where they sort of pop up and you can kind of check things out. We actually created one for some healthcare quality week swag. So if you haven't seen that yet, check it out. I've heard there's some really cool stuff. So just kind of makes it fun. And you can think of us as you're having all those materials on your desk and seeing them float around your offices. So thanks everybody for an awesome week. Really appreciate you. Keep doing the great work that you're doing. And please count on NAHQ to be your professional home. We are here for you. Have a good week.